Okay. Single leg hip hinges. We're gonna progress this from the double leg hip hinge. So we always wanna work on going from double leg to single leg, especially if you're doing things like running, where that's a single leg falling sort of activity. But even if you're not, we're gonna have differences in the way each limb functions. We wanna make sure that each limb is strong, independent of the other. So we can do a single leg hip hinge. I like to do a kickstand. So I'm doing 80% of my weight on my right leg, 20% of my weight on my left toe, just for some balance. So we can do it with just no resistance, nothing, just to practice the movement pattern. I'm always wanting you to feel 50% more glute than quad. It does get pretty easy here to find and isolate that glute, so this is a nice exercise too to learn to find your glutes as well. So as I go to stand, I'm pushing through my heel, engage my glutes, exhale to stand, engage that pelvic floor low ab for that core activation. Okay, so again, 2 sets to fatigue here, 2 sets of 15 reps or so, make sure that glute is tired. So that's the first thing we can do. Then we can add some resistance. So I'm gonna add a hand weight. I'm using 15 pounds, you can certainly start much lower than that. Adding a row is really nice, first of all, because my left shoulder blade and my lat is going to connect to my right glute. It's going to create this nice X pattern across my back, which is going to help support my SI joint. So getting this cross body strength and activation is going to provide some really nice stability across your low back and SI joint. So to do a single leg hinge with a row, we're 80%, 20%. Hinge, my arm is just gonna hang, but now I'm doing a row. So I'm pulling down and back with my left shoulder blade, release the row, stand back up. Hinge down, pull down and back with left shoulder blade, avoiding using upper traps on that left arm. Release the row, exhale to stand. My right glute, find my core. Okay, so again, 2 sets to fatigue, up to 15 reps. Do both sides, obviously. You might find differences in each side. A third way that I like to do it, we can involve some adductors a little bit. So those adductors are going to be big hip and knee stabilizers, but they also feed up into that pubic bone. So if you're having pubic symphysis pain, postpartum, or during pregnancy, honestly, getting those adductors strong to stabilize that pubic bone is going to help you reduce that pain and rehab that area. So we can use a foam roller. This is a pretty long one. Long or short is fine. You just have to find the right angle. So I'm pushing that foam roller into the wall. I'm gonna push my knee into that foam roller. So now, same setup. I'm pushing my knee into that foam roller, 80%, 20%, and then I'm gonna hinge forward. You can do a little bit of a reach for your opposite toes as well, which is gonna add a little bit of rotation that also helps with adductors fire. As I push to stand, I'm gonna exhale, engage that glute again, okay? So hinge forward, reach for opposite toe, exhale, push to stand, push into that roller, find your glute. Again, 2 sets to fatigue, up to 15 reps. Do both sides.